Hi everybody, it's Enrica again. Today is January the 4th, and what I want to talk about today is the first part of my surgery. So I went into the hospital for my gastric sleeve procedure on December the 27th, and since I had been already pre-admitted into the hospital, I had had blood work done the day before. All I had to do was show up that morning. I already had been banded for the hospital, so yeah, I showed up and reported to the holding room for surgery, and I had my aunt with me, and immediately I got a really good feel from the hospital. I really didn't know what to expect. I was pretty sure I was going to be nervous and freaking out, and I have a tendency to just kind of start to overthink things, and I kind of create a lot of anxiety that way. But that morning I was pretty calm. They immediately prepped me for surgery. They put the IV in. I had to put on all of the hospital gown gear, and it really was a lot. I was surprised. I thought, hospital gown and that's it. But actually, they make you wear several odd pieces of clothing. They had something called Ted hose, which I had to wear, which were like really thick white pantyhose. Only they went up to the thigh, and it was missing like the middle part. So that was kind of odd because you don't wear any underwear or anything like that under the gown. So I had both of those on, and those were mainly for blood clots, to prevent blood clots from forming. And I also had a hospital gown that tied around. It had a sash. It had all of these slits in it where you could hook this hose up and keep you warm if you got warm, or it would cool you off or keep you warm, or however you wanted. And then I also had these really thick tight socks on that had the skid, anti-skid pads on them so that I wouldn't slip. Besides having my hospital band, I had a nice, beautiful yellow bracelet with the big words that said fall risk. So I really appreciated the confidence there. But I knew, after surgery, they want you to get up right away and start walking. So I was a little concerned about that. Of course, I didn't want to fall right after having surgery, but I know I'm already a klutz, so I was thinking, it's probably going to be me. I'm probably going to be the one that falls. But anyway, after they prepped me, they let my aunt back in, and I was able to spend the next 2 hours with her. I had showed up at 7:30, and my surgery was actually at 9:30. So in that time, I was waiting. The doctor, the surgeon that was doing my surgery, was already doing one procedure that morning. So I was after whoever was first up. So they told me as soon as he was done and out of surgery, he would come in and talk to me. And I talked to the anesthesiologist, and they explained what they were going to do. And it really went by quickly. It really helped having someone there who talked with me and made me laugh and made me forget what I was there waiting for. So I didn't get that chance to get really anxious and scared. I had talked both to the anesthesiologist and the doctor, so I waited, and when it was time, they came in, and I got the first shot, which was for SED, and it was explained to me that from that point on I wouldn't remember anything. I'd still be awake and talking. I could still move to the operating table and do all things like that, but I wouldn't, when waking up, remember any of it. So it was kind of fun. I felt it immediately. I could feel this little happy, bubbly feeling coming up the tube. So that was the last memory that I had. When I woke up in recovery, I did not enjoy that part of it, and I'm sure nobody does. I've heard rumors of people that do really well with anesthesia. I woke up in a lot of pain. I was very disoriented and very confused, but the worst part of it was I think I woke up a little too early. The nurse had explained that I would probably still, at least my brain would still be asleep until they got a chance to remove the tube that was in my mouth that they were using to put the scope down, and also the tubes that I had in my nose. So they said almost all patients wake up after we have a chance to remove all that stuff. Some people, their brains start being a little bit more active sooner than others, and I just lucked out to be that one one or two people that happens to, but I woke up to the sounds of screaming, and I was in a recovery room, and there were different beds. There were about 6 or 7 other beds that all had curtains around them, and there were other people coming out of surgery and out of anesthesia, and they were yelling. There were 2 of them yelling and screaming. There was a man and a woman, and it really freaked me out because I just didn't know what was happening. So that was horrible. I really have to admit. But the nurse saw the instant I woke up. She yanked that little tube that was still in my nose that was really painful just breathing with it. But when she pulled it out, I could see it was bloody. It was horrible. But I mean, she instantly gave me a dose of morphine, and I didn't remember anything after that. I know I was in pain. I don't remember what the pain was like, but I just woke up feeling like, oh my God, what's going on? Everything hurt. Everything just felt horrible. The room was spinning. So the next thing that I remembered was being in my actual hospital room that I was going to spend the night in, and I had family already there waiting, and I really don't remember who was there, what was said, what I did. I do know I got up right away and I tried to go to the bathroom because I had this horrible feeling and pressure, like I had to just pee so bad, and I couldn't. And it was explained to me it was the anesthesia. As it starts to work out of your body, different parts of your body start to wake up, and my bladder, I guess, wasn't awake yet. So the nurse said, don't worry, if it still is like that later on today, we'll just use a catheter, which of course, I didn't want to do. So luckily, everything just kind of evened itself out. That first day was hard. There was a lot of pain. There was a lot of feeling very unsteady on my feet. I did make sure I got up and I walked. I walked about 4 or 5 times that day and throughout the night. But it was just kind of a blur because I was on the morphine so often. I was only up for maybe an hour at a time, and then I would sleep for 2 hours. So as hard as that day was, it was short, and I don't remember much of it, and I guess that's just a godsend. I do remember having the feeling of this utter panic of what did I just do? What did I do to my body? No, I want it reversed. Excuse me, I can't do this. I kept thinking, I don't know how I'm going to be discharged from the hospital. I'm in so much pain. How can I go home tomorrow? I'm hurt. I can't stand. I can't go to the bathroom. I just, every horrible thought went through my head, and it was a real feeling of panic. So I really didn't know at that point what I was getting myself into. I had my friend, the assistant principal, go through it and talk to me, I think the next day, and she told me, don't worry, the first day is going to be very difficult, but you're going to wake up on the second day and it's going to be totally different. At that point, I didn't believe it. I really didn't, because I was just so panicked. I thought, this pain is horrible. It's never going to go away. But as I said, it's luckily the kind of pain that it might have been intense at the time, but just like childbirth, thank God, you don't remember it. You don't remember the intensity after. So what I want to do is I want to continue next video talking about the next day, day 2 of surgery, which I actually got discharged from the hospital. So until then, I hope you all have a great day.